they all should have. So maybe it is a good idea to do a necropsy and to pair someone who is used to doing a necropsy with someone who has not done a lot of necropsies. Does that sound like a plan?
Yes.
How many of you are experienced in chicken necropsies? Close to 20. Okay. So you could find someone, so those of you who are not experienced, you could find someone who's experienced, do the necropsy, and then you take another bird where the person who does not have the experience actually does the whole necropsy.
Who do you have the experience? Sorry, who have the experience?
Who don't experience?
Who does not have experience doing a chicken necropsy?
Is that it?
Yeah, we have a few epidemiologists in here.
It's okay. Boki, možete samo.
So are we in agreement with that plan?
Yes.
Yes.
And I understand that we cannot all do necropsies at the same time.
We need to divide into.
Yeah. Really, we can't have a couple of tables out under the awning? Okay.
Fire security.
Because, you know, that necropsy room is pretty small, even for 20 people.
Maybe 3 groups. We have 4 hours.
Okay. We also have some more case scenarios for the afternoon. So, by the way, we're not taking any of these home with us. So those of you who want to take the pages home, you're welcome to them. Okay. Into some of these GI diseases. Exercises! How did you like the exercises?
Yeah.
Easier than this. So those are some of the diseases. There are 2 others, but these are specifically gastrointestinal. All right. Did you recognize this disease?
Yes.
This was the one. Runting-Stunting syndrome. Have you seen this Runting-Stunting syndrome? It's also called pale bird syndrome or malabsorption.
Helicobacter disease.
You think so?
Yeah.
You think it's Helicobacter?
No, Helicobacter.
No, helicopter.
Helicopter disease. Helicopter. Helicopter. Helicobacter. Helicopter.
Yes, I heard a lot of agents proposed, but not that one. What causes the helicopter feathers? How? There's so much we're going to learn about the pathogenesis of this disease. There are some people who say, well, the helicopter feathers are because it's poor absorption, so they don't have the right ingredients to actually make the feathers go the way they're supposed to. But why doesn't it happen in other malabsorption syndromes?
Many things.
Many things. Yes. Okay.
And what's the reason for that?
I wish I knew.
That means that okay.
Yes. Yeah. I don't know.
Not discovered yet.
You have an idea?
No.
And their intestines are fluid-filled, a lot of froth. To me, it looks like a rotavirus in a calf. Or a piglet. And the histology. So, this is obvious?
No, I'm just joking.
Oh. Yes, villus atrophy, which you would think, oh, rotavirus or coronavirus, but then there's also, the crypts are dilated. So, this is Runting-Stunting syndrome. You've got unequal growth within the flock. And these characteristic helicopter feathers, because they go out to the side like the rotors of a helicopter. Who knows why? Fluid-filled intestines, and they seem quite thin too because the mucosa is attenuated. Yeah, not absorbing much. And some say there's also pancreatic atrophy. So, what causes it? What causes runting? Have you seen runting stunting
Yeah,
syndrome?
real webs.
Yes.
Real webs.
What causes it? What do you do for it?
Vaccinate.
What do you vaccinate?
Vladovik.
Vladimir.
Vlado bi samo,
Everything.
bi samo da prodaje vakcine.
I worked on this disease in turkeys, and we found a lot of astrovirus in there. But I don't read the same for chickens. Is it a coronavirus, a rotavirus, an enterovirus? And is it a new disease? Yeah. How do we get it? Where's it going to take us? To me, this disease is rich because if you're going to work on a PhD, this would be the disease to pick. You could actually make a lot of progress because we really don't know anything about it yet. Any comments about runting stunting syndrome?
What do you mean we don't know anything about this?
We don't know if it's a reovirus, a rotavirus, an astrovirus. We don't know what the environmental predisposition is. We don't know how it gets. We don't know what causes the helicopter feathers to form.
Okay, so helicopter feathers, but vaccinating the parents against the Rio, I'm saying, really diminishes problem in the broilers.
It does. So you vaccinate them against reovirus, and that's reovirus and not rotavirus. Because rotavirus is a reovirus, isn't it? Isn't roto in the reovirus group?
Yeah, yes.
Uh-huh. So you actually vaccinate them against rotavirus?
Reovirus?
That's that.
Okay.
So there's an avian reovirus. Okay. It decreases the amount you see in the flock, but does it actually get rid of the disease?
Mostly yes.
Mostly.
If
Okay.
you are talking about 0.05% of broilers with the problems
Yes.
compared to the, let's say, 5 to 10%,
Uh-huh.
then it's really something.
Okay, so you believe it's a reovirus?
I would say can be some other things can also increase the
Yes.
incidence, like mycotoxins, but
Yeah, I wonder if there's another something else in there working to promote it. I don't know. I haven't read the papers that say reovirus yet.
okay.
I did look through the literature. I see astro, I see rota, rio, entero. Yes, but enteroviruses are corniviridae, aren't they? Okay. Wow, look at that. To me, it looks like there should be 2 viruses because you've got necrosis of the crypts and also villus atrophy without ulceration, which is quite unusual for a virus that affects the crypts, right? The viruses that affect the crypts.
Yes.
Canine parvovirus, feline panleukopenia,
Yeah.
BVD,
Yes.
rinderpest, PPR. They affect the crypts, you get ulcers. Why do we get ulcers with this? Okay. How about a big I don't know? Yeah. Necrotic enteritis. Did you get this one?
Yeah.
Yes.
All right. So, oh, wow. Oh, what do you think is inside there?
Blood sausage.
Yum, yum. Blood sausage. Some people call it a Turkish towel. Why Turkish? Can't it just be bath towel? So what's the causative agent? Which one?
Pathogens.
Perfringens. It's usually type A, isn't it? It's usually type A, sometimes it's type C. What's the pathogenesis of most Clostridia in the gut? How do they cause
damage.
disease?
Enterotoxins.
And that's actually an exotoxin. Gram-positive organisms have exotoxins, so they spew their exotoxin, which damages not only the epithelial cells, but also works on the vasculature. So you think of all the clostridial gut diseases, they all turn out to be pretty red, don't they? Because they're impacting the vasculature. Predisposing factors.
The feed.
Coccidia will predispose, right?
Yes.
Okay, so they have the Clostridia in their gut already, right? Stress. Stress will do it. Also, rich feed. What is it? They call it it's animal fats, which are very rich. They're richer
Fish
than the
meal.
vegetable fats. And is it barley?
Barley.
Corn? Is it corn?
Corn.
So you give them a lot to eat, a lot of rich food. It's the same in calves and lambs and kids. You give them a lot of rich foods and the Clostridia go crazy! And they change the flora, many more Clostridia than they make their exotoxins. Can you clean it up? Can you get rid of it? Why not?
Normal microbiota.
That's right! Yes, any chick you culture is going to have Clostridium perfringens in its gut. Do we have Clostridium perfringens in our gut? Probably.
Yeah.
Yes.
Yeah.
Yes.
Okay. Maybe not mine, but hers. Here's the Turkish towel. Yeah. A lot of necrosis. So Coccidia will do it, animal fats. And you get an overgrowth of the Clostridia. And here's normal, here's damaged.
Sorry, is it animal fat or it's fiber content of the feed?
I thought it was animal fat. Anybody know?
Because as far as I know, it's fiber content, high fiber content in the feed.
Yes.
High fiber?
Fiber.
Yes.
High fiber? Would that be these?
Non-starch polysaccharides.
Rye and oat, yes.
Rye and oats are high fiber? Okay. Specifically, I don't know. Does anyone here know high fiber and necrotic enteritis? Comments? Oh, hello. Hello, we're a little collection of Clostridia. How about this one? Did you get this one, the pilorum disease, fall typhoid? I have trouble telling these two diseases apart. Do you have both of these diseases here? Pilorum?
Yeah.
Do you have pilorum? No. You mean the government says you don't have pilorum? You don't have pilorum. Do you have?
Very rare in small.
It's usually
But very, very rare.
usually a regulated disease. Do you have fall typhoid? Salmonella gallinarum.
Yes.
They're both septicemic diseases. They come in through the GI tract, cause septicemia, get seeded to different places, and then cause lesions. Liver, ovary, pericardium. And for some reason they talk about pilorum disease causing white diarrhea. But I think most typically it's these nodules. pilorum disease. Fowl typhoid can do the same thing. Usually pilorum disease we see in the younger birds, fowl typhoid a little bit older. But they're both septicemic diseases where they form granulomas. Just like Salmonella does in mammals. Paratyphoid nodules. So they're two different organisms, but almost everything about them is similar, except for the age groups. Pilorum, fall typhoid, and chickens can carry them, and the one problem with both of these is they go through the egg. Horizontal transmission, there it goes, into the gut. You see it?
Yes.
Colonizes the mucosa, gets into macrophages, goes to other organs, and they shed it. Both of them. If you see these diseases, it's probably something that needs to be cleaned out. And pilorum is really noted for its ability to transmit vertically, so it's hard to clean out of a flock. We got rid of pilorum disease in the U.S. maybe 25 years ago. So I've never seen a case in the U.S. Salmonella can come in with people, it can come in with rodents, it can come in with wild birds. Salmonella is bad. And they talk about, I don't know why people talk about the color of diarrhea. To me, diarrhea is diarrhea unless it's bloody. Then you should talk about color, right? Because if it's bloody diarrhea, that means it's large intestine. But here they talk about bacillary white diarrhea. Pigeons brought it in. You can get these granulomas that form in multiple organs. Pilorum disease. Okay, I think we'll go through these. You like these or not?
No.
No, you don't like these. So fall typhoid. Yes, you really have to culture them to know whether you're dealing with fall typhoid or pilorum disease. It's either Salmonella pilorum or Salmonella gallinarum. The age can make somewhat of a difference. They can form a fibrin cast. Okay. This is get us ready for lunch.
Yeah? Bet.
So we have another one of the GI diseases to do. Okay. What was this disease?
Oh, Coccidiosis.
Coccidiosis. Okay. And you can diagnose this via scraping. So what are the important things to know about coccidiosis? You've all seen coccidia.
Yeah.
Uh-huh.
Yes.
What do you do about it when you see it?
To kill.
Treat? Okay, good. You have to treat with something that's going to kill that protozoan. And knowing which coccidia it is might help. So acerbulina. Maxima is a bad one in the jejunum. And what's the one in the ceca that's really bad? Tenella. Right. So this is probably acerbulina or Necatrix or Maxima. And then there's Tenella. So what are these things right here? Single tonsils. And what disease are those important in? Newcastle. So it only takes 2 days by the time those spores come out the hind end, by the time the little oocysts come out the hind end, it's only 2 days before they're infectious. So environmental contamination problem. It is sexual reproduction inside the host, both asexual and sexual. So that's why I like to emphasize that the coccidia have to live in a neighborhood because it have to be the males and the females together in order to reproduce. So you'll see a whole area that's just filled with coccidia. So sometimes you might miss it histologically because you take an area that's not the neighborhood. Okay. Everybody stand up. Stand up. Stand up. We had 2 other diseases in this group. Anybody know some people who act like this chicken? Yeah. Oh, I'm really important. Yeah. And I'm also kind of ugly. So, we've got 2 very serious diseases of poultry to talk about that it would be good to make sure everybody can recognize them. What are the 2 very serious diseases of poultry that require notification to the OIE?
Pathogenic avian influenza.
IPAI and Newcastle. So those are the 2 diseases we're going to talk about now. You can sit down if you want. You can remain standing. So I know lots of people who stand at the front of the room and say, if you have a whole lot of chickens dead, you can't tell if it's Newcastle or High-Path AI. I'm here to tell you, I believe you can. But only if you understand the pathogenesis. So, the pathogenesis of Newcastle. And here we're talking about virulent Newcastle. Remember, there's lentogenic, mesogenic. We're talking about the bad Newcastle. A lot of us vaccinate against the mesogens because, you know, the middle of the road strains, because they will allow other agents to come in, they're upper respiratory. But the virulent ones, the ones we have to notify the OIE about, the very virulent ones are not respiratory diseases. They are not. They're infections of macrophages. And I'll show you. So, here we have a Newcastle virus. And this Newcastle virus, the virulent ones have the capacity to get into macrophages. Where are macrophages in the chicken? Tell me. Or you can read. So it's a big lymphoid patch here. Remember, chickens have no lymph nodes.
Yeah.
Spleen, cecal tonsils, bursa. All right. So that's the cell they infect. So let's see what happens. So here's the virus, gets into the eyelid, and it's going to replicate there. It's going to replicate in the spleen. It's going to replicate in the cecal tonsils, big lymphoid patch. Where does it go from there? It goes out the poop chute. Yes, to contaminate the environment for other chickens. Now, all of these macrophages, that's it, it's infecting. Newcastle disease, the virus, has the ability to turn those macrophages on. Really hyperactivate them so that they are spewing cytokines. How do you feel when you have a lot of cytokines circulating in your body? The acute phase response. Pretty awful. Yeah. And that's what kills the bird. It's a cytokine storm. You get necrosis and hemorrhage everywhere where these macrophages are. Cytokine storm, and the bird dies. So what will you see for lesions? Hemorrhage, necrosis in the eyelid, necrosis in the spleen, cecal tonsils, and everywhere I go, I see Newcastle. So if the birds are vaccinated, which a lot of people do to protect against the mesogens, then when you get one of these very virulent strains come in, they're protected against this macrophage form of the disease. So you're not going to see cecal tonsil hemorrhage. You're not going to see splenic necrosis. So they survive that stage, and the virus goes to the brain, and it especially likes the cerebellum and the spinal cord. We know this from numerous experimental studies we've done. So this is a chicken we bought for a necropsy in Cape Verde in West Africa. It couldn't stand up. It had Newcastle. We did the necropsy. This is in Jordan. I went out, what disease do you think it is? Everybody said, oh, this is Larynx. The nerves were fine. It was Newcastle. We found it in the brain. Here is Afghanistan. That is a necrotic spleen. We did PCR. It was Newcastle. Another country, Newcastle. Uganda, we were doing chicken necropsies. Newcastle, there's a lot of lymphoid tissue in the proventriculus. So there's macrophages there. Here's a spleen from one bird, spleen from another bird. The bird was the same size. And last week in Ethiopia, splenic necrosis, proventricular hemorrhage. This virus circulates continuously among backyard birds. Sometimes they're vaccinated, but it's not a sterile immunity, so they continue to shed it when they're infected. I believe that Newcastle actually causes more protein loss and difficulty for poor people than high-path AI. But high-path AI has killed a few people, and that makes it famous. All right. Who's seen Newcastle? Virulent Newcastle. So you have it. Okay. 3 days ago, we were free of it in the U.S. We had a big outbreak in 2003. A few days ago, we got news that there's a very small outbreak in Los Angeles. They think it's due to someone bringing pet birds in illegally. Parrots, citizen birds will carry the virus and shed it. Comments about Newcastle? So you want another one?
Yes.
Just also to mention,
Please.
pigeon paramyxovirus causes Newcastle.
Thank you. Will you talk about that? Because that's a European thing.
Yeah. Well, it's basically we used to see it, and if we had birds in for surveillance of Newcastle disease, particularly pigeons, it was something to be aware of, because pigeon paramyxovirus is not notifiable in the UK, whereas Newcastle disease is. So that was the key difference. But regarding the pathology, we used to see greenish diarrhea, interstitial nephritis, like lesions like you see with Newcastle disease, but not the cecal tonsil necrosis in quite the same way as you see behind Newcastle disease, and also neurological signs we used to see.
Okay, so the virus does get to the brain.
Yeah.
Okay, we did some experiments with pigeons, put both Newcastle and pigeon paramyxovirus into them, and the pigeons got loose in the room. It was pretty hard to catch them, you know? We had to get a big net. This is in biosafety level 3. Quite an adventure. I don't care to work with pigeons again. And we put pigeon paramyxovirus into chickens, and they have a very mild disease, but they will replicate it, yes.
Cormorants also are carriers, right? Of Newcastle?
Okay.
I was just thinking LA.
Yeah, cormorants, right, and they actually get the bad form of the disease, the die-offs. Yeah, wild birds will carry these. All right, the next one. This is what I think of highly pathogenic avian influenza. You know, the medical community sees it like this, they want to kill all the birds. But from an agricultural perspective, it does not continually circulate. It makes a big outbreak. The outbreak moves around, and we get rid of it. And then we don't see it until there's another outbreak. Pathogenesis. So, lock and key. What's the primary cell that the high-path AI virus likes? It likes endothelium. And I believe it especially likes endothelium of capillaries that are at slightly lower than normal body temperature. So where would those be?
Periphery. On the periphery of the body.
Yes! So it'd be comb, wattles, subcutaneous tissues, shanks. So that's where it goes. Gets in by droplets. And then it actually causes replication in those peripheral areas and causes a dysfunction of the endothelium. And the bird dies with edema and hemorrhage. Now, some of these more severe strains, actually, when it'll go from the endothelium and it'll spill out, and there's so much virus that it gets into the adjacent cell. So you'll see a myocardial infection, you'll see a pulmonary infection, you'll see a cerebral infection. But without going too far, it does start out in the endothelium, and that's how it gets to all those other tissues.
So Corrie, how many viruses do you see that are endothelial-tropic?
What are the viruses that infect endothelium? Can you think of some?
Luton?
Luton! Yes!
That's fine fever.
Classical swine fever! Good, yes! Others?
BBD border. All pest viruses.
You know what? I think so, but I also think of BBD as being one of those promiscuous viruses. It'll get in an endothelium, it'll get in, kind of like classical swine fever. Yes. African horse sickness. Yeah. Others? Okay. So, this is what we see. Swollen head. This picture, I took this picture in Afghanistan. I was there when it was the H5N1 outbreak in Pakistan. And broilers were continuing to come across the border, and sure enough, there it was, lots of subcutaneous edema. Shank hemorrhage. Now, a lot of people say if you see tracheal hemorrhage, you can't tell if it's Newcastle or high-path AI. What do you think now? Where are the macrophages in the upper respiratory tract? They're in the pharynx. So with Newcastle, you can see hemorrhage in the pharynx, but it doesn't go down the trachea. But high-path AI will go all the way down the trachea because of all those capillaries. Yeah, the lungs too. H5N1, and you are working on H5N8 in birds.
Yes,
Okay, how's it different?
it's quite similar.
Similar?
In chickens, we didn't have any external lesions like hemorrhages, cyanosis of vital forms.
And no edema?
No edema, we only have gross lesions.
Of what?
Internally. Myocardium, lungs, pancreas, and kidneys.
Okay. Okay, how many strains of highly pathogenic avian influenza are there? Do you think? How many strains? So many! Yes! Yes! So that doesn't mean every single strain is going to infect humans. Does H5N8 infect humans?
Still not. Yes.
Okay. And what's the answer for almost all the poultry diseases?
Biosecurity.
There you go. Yeah.
Protection.
So let's see if we can tell the difference. So the answer, if this is true of Newcastle, it will turn blue. If it's true of HPAI, it will turn red. If it's true of both, it will turn purple. Talk to the person next to you and decide which disease belongs to each of these. Go, you have 1 minute. Okay! Yeah! Nicola, the king! Yes! The first one.
The first one,
What color will it be?
both.
Purple. All right. Is there anything else that kills so many chickens like this? Do you think of any other disease that's going to come in and wipe out most of a house? I think that in the summer, if the ventilation doesn't work,
Yeah.
yeah. If the water gets plugged,
Yeah.
or if you're on the continent of Africa, maybe Gomoro. But otherwise, nothing. And what?
Toxicosis.
Toxic. Okay, something acute, toxic, bad. Yes. Okay. Infects macrophages. Peter, what do you think? Okay. Infects endothelial cells. Libriana. Biliana. Okay. Yes. It's a global problem in backyard chickens.
Both.
Yeah. Right.
Only Newcastle. Okay. Usually high pathogenic surfaces causes an outbreak. We control it, get rid of it, and it doesn't continue to circulate. Some exceptions. What is it that takes high pathogenic from one place to another?
Wild birds.
Wild birds. How do wild birds do it?
They fly.
Sure. Okay. So the receptor is the receptor for high pathogenic. It's kind of sialic acid. Yes. And we know that waterfowl have that receptor in their intestines. Yeah. And as they fly, we call them indiscreet defecators. So they take the virus from one place to another. I don't think domestic fowl have those receptors in the gut, do they? Yes, so it's waterfowl that take it. Okay. And the last one, everybody? Whoa!
Rainbow.
All right. Okay. It's been a great pleasure this morning. I do believe it's lunchtime. Do you want to give us instructions about what we do for lunch besides find a restaurant? Are there restaurants nearby?
This is then we just can. It's near the restaurant, and we together go
Oh,
to the
we're all
restaurant.
eating together.
Yeah, all together.
Oh, okay.
Just one more. I have one information according to the certificates. We will give them to you the third day of the yearly conference. So if somebody comes just here in the poultry section, so please give me your name. Okay? You do. Okay. Ostali